We're going to spend this morning talking about treating migraines. Now, a week ago, we told the story of Serene Branson, the reporter in Los Angeles who had aphasia. She, on air, you might have seen it when she was covering the Grammys, she kind of lost her ability to speak, and the doctor said that was a symptom of the aura from a migraine, preceding a migraine. Well, we did the story and got so much feedback from our viewers who want to know more about alternative treatments, ideas on how to treat it, and we've even heard from some specialists in our community. So this morning, we're bringing them in. This is Dr. Sarah Pace with Pace Family Chiropractic in Brighton. How are you?
Great. How are you?
Very good. Well, you brought something that I can't wait for you to show our viewers this, because if you suffer from migraines, yes, there are medications, but one of the reasons we want Dr. Sarah here is because there are many people who can't take all or at least some of the migraine medications. Maybe you're allergic, maybe you said
pregnancies.
Pregnancies, well, or if you have depression and you have certain medications and you can't interact. So, tell me about chiropractic for this.
Well, chiropractic, we work with your nervous system. So I focus on the spine and in particular with the neck as far as with migraines. So you're supposed to have this beautiful C curve in your neck. They call it lordosis, and most medical doctors would acknowledge that. And
so again, show maybe the side angle here. Let's do this.
Yep.
It's supposed to be like this, right?
Yep, C curve. So there's the back and then that C curve. And everyone should have that their whole life.
Okay, but you know, a lot of migraine sufferers you find have what?
Yes, they are actually going completely the opposite way. We call it a kyphosis in the neck, or a reversal is a more common term, and that happens from trauma, whether it's a car accident, a fall, and you might not necessarily have had the pain per se when that fall happened or that car accident, but it shows up later on in his life as this, and it can lead to arthritis and pain, and these nerves that are coming out of this neck are feeding your head. So a lot of people get symptoms as just common tension headaches, migraines, and we have great success in our office helping with that.
Okay, so a couple quick questions. First of all, what percentage of migraine sufferers that you see have this instead of the good curve?
I'm going to say probably 90%.
Wow, okay.
Yeah.
But for the 10% who don't, can you still treat them?
Oh yeah, because some people just have it where it's too straight or it just is a little forward. Like people that sit at computers all day have a lot of forward head posture.
That's frightening.
And that can, and that's 90% of our workforce today. So that can create some tension in the neck as well.
And I think we have some photos from your practice that we can show that kind of give you a look at what it looks like when you're working. And give us a sense for what we're looking at, Doctor.
And up in that corner, I'm adjusting one of my patients, and a lot of perception of chiropractic is that it's very aggressive and they're ripping and crunching your neck, and it's very gentle. We use that drop table, so those little pieces in the middle, they pop up about an inch and then they drop. It's very, very light. I have kids in my office from 2 years old all the way to 90-year-olds, and we've never had an issue. This is the neck adjustment where some people it's called a rotary adjustment, and it can be frightening for people, but it's very gentle. And and if people don't need that type of adjustment, I don't do it. I use a lot of drop work, so it's very, very light for people. So people that don't want that. And then we in our office actually do what's called traction. So my technique is called CBP. It's corrective chiropractic, and we actually correct that curve. So if you have that reversal in that neck, we can actually restore some of that and take the pressure off the nerves.
How long does that take to get there?
To correct it? It all depends on how long it's been in there. Sometimes 6 months, sometimes a year, sometimes 3 months. I mean, it depends on how long it's been going on.
Gradual, incremental treatments, not one big painful treatment.
No. We start with a couple minutes in traction, and you build up, and it's very light, very gentle. And like I said, I have 90-year-olds able to do this type of stuff, so it's very, very gentle.
I want to stress, too, you're going to hear later this morning from ophthalmologists and neurological doctors, and they understand that there are people who can't take the medication they prescribe, and they think there has been a lot of success with this kind of practice. This is a preventative practice, but it's also, you've treated people who come in during a migraine.
Yeah, I had a patient come in Wednesday, left work at lunch with a migraine, and I adjusted him, and his wife works in my office, and I came back after lunch and said, "How's he feeling?" She said, "1 million times better, he's back at work."
Wow.
So it can kind of reduce those symptoms when they're at full blast. So definitely.
But before we go, let's ask the questions I know our viewers are asking. Does insurance cover it, and how much does it cost?
A lot of times insurance does cover it. A typical adjustment in my office is $40 with the traction. That's pretty standard across Rochester for an adjustment, but there are a lot of insurances starting to accept it. So it is great. We call on everyone's insurance and find out and work with a plan with them.
And where do they find you?
1968 South Clinton Avenue in Rochester, right in the Tops Plaza.
And are you online?
Yep. It's www.afcrochesterny.com.
Okay, we'll put a link to that on our website on the Find It button later this morning so you can find it. I also want to stress, too, we heard from some other patients of other chiropractors. Dr. Sarah, so nice to have you come in.
Thank you.
It's a great community of chiropractors here who do these services,
yes.
and if it can work for you, great. More migraine treatments coming up later. We're going to talk acupuncture. Does that work? We're going to talk other medicines that you might not have considered. It's all coming up later this morning. Stay with us.